Yeah, we're doing, one of the things we're doing now is we're doing a movement and range of motion screening, looking for individual deficits on people and starting to teach them ways to fix these deficits before they're, even before or during when they're doing the activity. Empower the athlete to learn to understand their own body, figure out how they move, what causes them issues. And you find simple things. If you have range of motion deficits and movement deficits, you know, if you correct some of those things, when an athlete comes back to you and say, yeah, now when I squat, my back and knees don't hurt anymore. Now I feel it in my quads and my glutes. Well, gee, go figure. You're feeling exactly where you're supposed to. Well, why were they hurting their knees and their back? Well, because they didn't have, it's something as simple as they didn't have enough ankle dorsiflexion to actually sit back and squat where they were supposed to. So therefore, something as simple as fixing ankle dorsiflexion on people can actually allow them to work without aggravating and injuring things. And so those type of screens that you can do beforehand to actually you figure out those deficits. Or you figure out deficits that are from injury and you realize, I'm not going to fix this. You have somebody who has a loss of ankle dorsiflexion because they had multiple ankle sprains and they have bone spurs. You're not going to get the dorsiflexion back. So if you try to, you're going to make them more sore. So instead of doing that, then those are the people you say, okay, when you squat, you shouldn't go as deep. Maybe we need to block your heels and raise you up a little bit, or maybe you should concentrate more on single leg stuff than double leg, because if you have a deficit one side to another, then that's going to put stress on your back more when you squat, and you have a higher risk of these type of injuries from doing your activities. So those type of screenings that we actually know the answer to, but we ignore them, or we don't have time, or we don't have the time to actually implement those things. So those are the type of things that we're trying to do.